In 2014, Flint's water failed the General Motors engine test but passed the baby test. Make it make sense. So just to be clear, transmission fluid got more protection than amniotic fluid. And somehow, this was official policy. April 25, 2014. The city of Flint, Michigan officially disconnects from the Detroit Water and Sewerage Department and switches to the Flint River as its primary water source. The justification is financial. This move will save approximately $5 million. Flint is broke, operating under an emergency manager, and $5 million is $5 million. On paper, it's a logical cost-cutting measure. In reality, it's speedrunning a public health apocalypse that will make international headlines and permanently ruin the phrase "tastes like pennies" for an entire generation. Residents notice the change immediately. The water is discolored, brown, sometimes orange. Swamp-adjacent, really. It smells wrong, tastes worse. Chemical tests reveal high levels of total trihalomethanes, or TTHMs, which are carcinogenic disinfection byproducts. This is viscerally obviously different water, and the official response is consistent. The water is safe, which is reassuring unless you have functioning taste buds or a basic understanding of what brown liquid typically signifies in nature. As a general rule, if it's brown and it's not coffee or chocolate, you probably shouldn't be drinking it. This feels like advice you'd give a toddler, but here we are. But here's where it gets absolutely wild. 6 months later, on October 13, 2014, General Motors announced it will stop using Flint River water at its engine plant. The reason? The water is corroding engine parts. Pause for a second and appreciate this. GM, a company that manufactures inanimate objects made of metal, looked at this water and said, "Nope, too dangerous for our car parts." Meanwhile, city and state officials continue insisting that this same water is perfectly safe for human consumption. If you're keeping score at home, Flint water is apparently fine for your kidneys but unacceptable for a transmission. Make it make sense. Now, you might assume this is where someone connects the dots. But you would be wrong. And I mean spectacularly, hilariously. How is this real life wrong? And in January of 2015, Detroit offered to reconnect Flint to its water system for free. Zero cost. The emergency manager declines the offer. To be clear, the emergency manager's entire job description is save money. Detroit offered a solution that cost $0. And he said no. This is like someone offering you a free parachute mid-freefall, and you replying, "Nah, I'm good, I've got this umbrella." So what was the point? That question becomes harder to ignore by June 24, 2015, when Miguel Del Toral, an EPA regulations manager, issues an internal memorandum identifying high lead levels and noting the complete absence of corrosion control treatment. One resident, Leanne Walters, has her home water tested. The result? 104 parts per billion of lead, approximately 7 times the EPA action level. A subsequent test registers 397 parts per billion. For context, the EPA action level is 15 parts per billion. Leanne's water was clocking in at numbers that would make a Geiger counter nervous. Del Toral writes his memo. Detroit offers free reconnection. GM refuses to use the water. Residents are complaining. The data is screaming. And the Michigan Department of Environmental Quality does nothing. No corrosion control is implemented. The warnings are ignored. At this point, calling it a decision implies deliberation. This was institutional paralysis dressed up as policy. It's the bureaucratic equivalent of your check engine light being actively on fire and deciding to finish your commute anyway. Think about the last time you complained about your tap water tasting weird. Did you assume someone was checking it? Or did you just buy bottled water and move on? Most people choose option 2. It's easier. It requires no confrontation with the possibility that the infrastructure might be failing. But Flint residents didn't have that luxury. It was the kind of water that makes you question whether plumbing was a mistake as a concept. But Flint's story is not unique. It's just the most famous example of a problem that spans dozens of cities and thousands of miles of failing pipe. And the deeper you dig into how water quality is tested in the United States, the more you realize that Flint wasn't an anomaly. It was just the one that got caught. Flint is the Enron of water crises, not because it was the only one cooking the books, but because it was the one that made the news. Here's something that should fundamentally disturb you. At least 33 cities in the United States, including Philadelphia, Boston, and Chicago, have been caught using testing methods specifically designed to artificially lower lead detection rates. This is documented, investigated, confirmed reality. These cities manipulate their water testing protocols to maintain federal compliance while actual contamination goes undetected. And the methods they use? They're so simple it's legitimately insulting. Like they're not even trying to be clever about it. Cheat number 1. Pre-stagnation flushing. The EPA's lead and copper rule requires water samples after a 6-hour stagnation period. The idea is to let water sit in pipes long enough to pick up any lead. But utilities instruct residents to run their taps for 5 minutes the night before collecting the sample. This clears the lead-laden water and replaces it with fresh water. Then, the 6-hour stagnation period begins, using water that was already flushed clean. It's the testing equivalent of brushing your teeth directly before a dentist appointment and expecting them not to notice you haven't flossed in 6 months. Cheat number 2. Aerator removal. Faucet aerators catch particulate matter, including lead particles. Before a sample is collected, residents are instructed to remove the aerator. This eliminates the trapped lead, producing a cleaner result that doesn't reflect normal use. So they're explicitly telling you to remove the thing that catches the lead before testing for lead. That's not a testing protocol, that's a magic trick. Sierra cheat number 3, slow flow. Residents are told to fill sample bottles slowly. High flow rates scour lead particles from pipe walls. This is what happens normally. Slow flow leaves the heavy lead sediment sitting in the pipe. Clean water sample, contaminated pipe. This is like a doctor asking you to exercise vigorously before checking your resting heart rate, then congratulating you on your cardiovascular health. It's a medical theater, or in this case, the municipal theater. Same energy, different stakes. Now, if you're thinking, surely there's a logical reason for these protocols, congratulations. You still have faith in institutions. Let's fix that. And by fix, I mean destroy. Buckle up. The EPA lead and copper rule is explicitly designed to capture worst-case scenarios. The entire point is to identify the highest possible lead exposure. The protocols adopted by these 33 cities systematically eliminate worst-case evidence. They don't measure reality. They measure a curated version engineered to pass regulatory scrutiny. Or better yet, it's like taking a pregnancy test exclusively after you've confirmed you're not pregnant. Congratulations, the test worked perfectly. And here's the part that should make you irrationally angry. The EPA warned against these practices. In 2006, they issued guidance discouraging pre-flushing. In 2008, they reiterated the warning. They didn't enforce a ban until after Flint became international news in 2016. So the EPA identified the problem in 2006, and then waited 8 years and one national scandal to do anything about it. The EPA noticed the house on fire in 2006, mentioned it might be warm in 2008, and called the fire department in 2016 after CNN showed up. Very zen. We'll get to it eventually. 21 of the 33 cities used the exact same methods that led to criminal charges against Flint officials. Same cheats, same manipulated data, same endangered children, but only Flint's officials faced legal consequences. So apparently water testing fraud is basically speeding on the highway. Everyone's doing it, but only the unlucky one who gets pulled over gets the ticket. Mark Edwards, the Virginia Tech scientist who helped expose the Flint crisis. I can put it bluntly. They make lead in water low when collecting samples for EPA compliance, even as it poisons kids who drink the water. The compliance data is scientifically engineered to hide the contamination it's required to reveal. If you want to see more cases where the official story collapses under the weight of its own contradictions, hit subscribe. Because this rabbit hole goes deeper. And by deeper, I mean Mariana's Trench deeper. We're just getting started. Ever wonder why your city sends you instructions instead of just sending someone to test? They're not helping you test correctly. They're helping you test wrong. And the instructions sound helpful. They sound official. Run the water, remove the aerator, fill slowly. These sound like reasonable steps. Nah, but they're deliberately designed to ensure an inaccurate sample that looks accurate enough to satisfy a checkbox. It's like being handed IKEA furniture instructions, but the instructions are specifically designed to make you build it wrong while feeling confident you built it right. The test is rigged. Not rigged in the shadowy conspiracy sense, rigged in the instruction manual sense. And when cities follow the loopholes, they get called compliant. Because if this is passing, I'm actively terrified to see what failing looks like. Do the pipes just start shooting flames? But the story gets stranger, and by stranger, I mean microbiologically creative. Buckle up, because we're about to add bacteria to this lead cocktail. Between 2001 and 2004, Washington, D.C. experienced its own lead contamination crisis. The trigger was switching from free chlorine to chloramine. On paper, a smart upgrade. In practice, it triggered a massive chemical reaction in the lead service lines. Lead spiked to over 100 parts per billion during summer months, so they tried to make the water safer and somehow made it more poisonous. It's like trying to fix a squeaky door and setting the house on fire. The Washington Aqueduct knew this was happening. They conducted pipe loop studies. They ran 2 sets. Rack 6 used water with unrepresentative pH control, producing artificially low lead results. Rack 7 used water that accurately represented the system and showed dangerously high lead levels. Naturally, they showed the public the Rack 6 data, except in this case the scale is public health and the 50 pounds is catastrophic lead poisoning, so, slightly higher stakes than your beach body. But wait, it gets better. The official charts were deliberately cut off after June 2006. Why June? Because lead spikes during summer months. The chart ends in June. Lead spikes in July? or releasing your quarterly earnings report but only including the months where you made money. Look how profitable we are, assuming you ignore July through December. The EPA eventually removed the misleading charts in July 2010, years after the crisis peaked. They published misleading charts during the crisis, left them up for years, then quietly deleted them once everyone stopped paying attention. Delete the evidence, but only after everyone's moved on to the next scandal. Very stealth. And very, we thought you forgot about this. Quick question. Do you know what disinfectant your city uses? So if you're thinking, surely they'd tell us if they changed something fundamental, I have some disappointing news about your relationship with your local water utility. They're just not that into transparency. Now here's where the chemical nightmare starts compounding. In Flint, the corrosion didn't just leach lead. It also consumed chlorine. When iron and lead corrode, they neutralize the chlorine. This leaves insufficient chlorine to destroy bacteria. The result? A spike in Legionnaire's disease. 87 cases, 10 people permanently unsubscribed from life. So the water gave people lead poisoning and bacterial infections. It's the municipal equivalent of a combo meal, except rather than fries and a drink, you get heavy metals and pneumonia. Meanwhile, lab results start identifying another class of contaminants, per- and polyfluoroalkyl substances, better known as PFAS. These are forever chemicals. They possess carbon-fluorine bonds, among the strongest in organic chemistry. They don't break down. They're hoarding space in your liver like a storage unit with a biological half-life extending over several years. PFAS is the stage 5 clinger of the chemical world. It moves in. It doesn't pay rent. It never leaves. Lead you can eventually excrete. PFAS, years. Plural. You can't boil it out. Carbon filters, the kind cities hand out for free, don't touch it. Removing PFAS requires reverse osmosis or ion exchange systems, which are expensive. It's the Airbnb guest that became a squatter. Except your Airbnb is your liver and you can't call the cops. The pipes are eating the disinfectant. Bacteria are breeding. Forever chemicals are accumulating. And nobody's treating this like an emergency. They're treating it like a billing problem. Because emergencies require solutions. Billing problems just require paperwork. And apparently paperwork is way easier than, fixing the water. The cleanup phase is where things get philosophically interesting. Because the question isn't, how do we fix this? It's, how do we make this look fixed while doing the absolute minimum? It's the municipal version of, we've investigated ourselves and found no wrongdoing, except with more bottled water distribution. In 2018, Newark, New Jersey faced its own lead crisis. The initial response? Denial. Newark's director called the accusations absolutely and outrageously false. He said this in 2018. Know what else happened in 2018? The city started distributing bottled water and filters. So the lead levels were outrageously false, but also dangerous enough to require emergency bottled water. This is Schrodinger's contamination. The lead both does and doesn't exist until a journalist opens the box. Very quantum, very confusing, very please stop asking questions. The Flint playbook was publicly available by this point. The denial phase, the false reassurances, the eventual admission, it was all documented. And Newark ran the exact same script. It's like watching someone slip on a banana peel, then immediately walking over and slipping on the exact same banana peel. Except the banana peel is a public health crisis, and you're a city government. Meanwhile, in Flint, government-issued phones belonging to 65 state officials were seized as evidence. 65 phones is a lot of discovery. That's not smoking evidence, that's a smoking arsenal. Somewhere there's a prosecutor scrolling through 65 phones worth of you seeing this water situation LOL texts and slowly losing their mind. In 2016, 3 Flint employees were criminally charged with falsifying water quality data. But 21 other cities were using the same protocols. And in those cities, no charges. So apparently testing fraud is legal as long as you don't become a CNN headline. It's the no harm, no foul rule, except there's definitely harm and also definitely foul. Mark Edwards stated it plainly. Clearly, the cheating and lax enforcement are needlessly harming children all over the United States. Because I'm not sure which one is scarier, that Flint was an outlier of villainy, or that they just had the misfortune of getting caught doing what everyone else was already doing. And then there's the cleanup itself. Cities don't fix the pipes, they distribute filters. This sounds helpful until you realize what's actually happening. The city has transferred the burden from municipal infrastructure to individual households. You are now responsible for purifying your own water. Your kitchen is now a water treatment facility. Congratulations on your surprise promotion to municipal water engineer. The pay is $0 and the benefits package is you don't get lead poisoning. Maybe. Nasi, if your employer handed you a hard hat and said, we can't fix the building, wear this at your desk, you'd update your resume. But when your city hands you a filter and says, infrastructure is hard, you just install it. Drop your theory in the comments. Does the official explanation fit the evidence, or are we all just pretending institutional failure is the same thing as a solution? Are we gaslighting ourselves? Is this collective Stockholm syndrome? I genuinely need to know. Cities distribute filters instead of fixing pipes. Agencies delete charts instead of explaining them. Officials seize phones instead of releasing data. If this was just a mistake, why does every correction look like damage control? Why does every solution look suspiciously like, we're making this your problem now? It's the political equivalent of a group project where one person does all the work and everyone else still gets credit, except the credit is lead exposure. Now we arrive at the part where things stop being about policy failures and start being about the limits of what we actually know. We're not just bad at enforcing the rules, we made bad rules. It's impressive, really, how many ways we found to fail simultaneously. The Safe Drinking Water Act regulates over 90 contaminants. 90 sounds like a lot until you realize there are tens of thousands of chemicals in use. The EPA tests for 90 of them. So when your city says your water meets all EPA standards, they actually mean we checked 90 things out of several thousand, and those 90 look fine. That's selective auditing. Good news, the kitchen, bathroom, eye, and hallway are fine. We didn't check the other 97 rooms, but statistically, they're probably also fine. Don't ask us to show our work. Take strontium. It's a bone-seeking radioactive element detected in 99% of public water systems. 7% exceed the health reference level. It accumulates in bones for years. And the EPA doesn't regulate it. It's not on the list, so it doesn't get tested. Because radioactive element in 99% of water systems sounds like a panic headline, but it's actually just reality. Welcome to infrastructure, where the problems are real, but the regulations don't matter. Or consider atmospheric deposition. Water and snow samples show elevated levels of aluminum, barium, and strontium. These aren't leaching from pipes. They're falling from the sky. Our industrial coal fly ash and soil dust settle into rivers and aquifers. Fringe groups attribute this to chemtrails, which is nonsense. But the data showing measurable atmospheric deposition of heavy metals is real. So the conspiracy theorists are wrong about the cause, but technically right about the effect. It's like being wrong on the test, but somehow getting the right answer. Congratulations, I guess. You've been drinking tap water your entire life. How many of those thousands of unregulated chemicals are in your body right now? Don't know? Neither does your city, neither does the EPA. Nobody's checking. We're all just walking chemistry experiments and nobody's recording the results. Science would be appalled if science weren't also part of the problem. This is the legal but unsafe gap. Non-compliance with the law does not equal biological safety. Your water can meet every federal standard and still contain unregulated contaminants that accumulate over decades. It's the regulatory equivalent of, technically, I didn't break any rules, which is what people say right before they explain how they absolutely broke the spirit of the rules. Standard carbon filters don't remove strontium or many PFAS variants. High-efficiency filtration costs real money, so cities don't use them. It's the thought that counts, except the thought is, how do we look like we're doing something without actually doing anything? A+ for effort. F- for outcomes. In Flint, the damage was so severe the pipes couldn't be salvaged. The only solution was total excavation and replacement, a process taking years and costing hundreds of millions. And replacement is politically unpopular because it requires admitting the infrastructure failed so catastrophically that temporary fixes won't work. It's the municipal equivalent of admitting your car is totaled. Nobody wants to accept it. Everyone wants to believe duct tape and optimism will fix the transmission. Spoiler, they won't. Here's another fun detail. Lead doesn't leach uniformly. It releases in erratic bursts. The Russian roulette effect. One test might show 0 lead. The next test, hours later from the same tap, might show dangerous levels. Variables you can't see. So every time you fill a glass, you're rolling dice you didn't know existed. Your morning water might be fine. Your evening water might be a felony. It's the plumbing equivalent of Schrodinger's cat. Except instead of a cat in a box, it's lead in your pipes. And you only find out if it's there after you've already drunk it. Super fun. Very reassuring. Compliance is a checklist. Biology is not. Your liver doesn't care if a chemical is on the EPA's regulatory list. It cares whether the chemical is in your liver. Your kidneys have never lied to you. The EPA has a spotty track record at best. I know who I'm betting on. Let's take inventory of what we're pretending is normal. The pipes are permanently damaged in thousands of cities. The tests are designed to hide contamination. The regulations cover a tiny fraction of existing chemicals. The filters don't remove the contaminants you need removed. And the burden of safety has been quietly transferred to you. You are now your own water treatment plant. Your kitchen is now a chemistry lab, and nobody asked if you wanted the job. Her plot twist. You're also not getting paid, or trained, or liability insurance. But hey, at least you got a free carbon filter that doesn't work. Silver linings. If the system can't guarantee safe water anymore, why are we still pretending it can? If this investigation disturbed your assumptions about infrastructure, share it. Let's make people uncomfortable together. Comfort is the enemy of accountability. And right now, we're all very comfortable pretending our tap water is fine. Spoiler alert, it's not. The Flint River switch was supposed to save $5 million. The actual cost exceeded $600 million. But here's the thing. Flint replaced their pipes. Most American cities have not. Flint became a headline because the crisis was acute, visible, and undeniable. Flint's water turned brown on camera. That's bad PR. Most cities have the good sense to poison their residents more subtly. But what do you call it when the crisis is chronic, invisible, and distributed across thousands of cities over decades? You don't call it a crisis. You call it normal. The pipes corrode slowly. The testing protocols quietly evolve to hide problems. The unregulated chemicals accumulate in tissues over lifetimes. There's no dramatic color change, no emergency press conference, just a slow, distributed failure that nobody notices because it happens to everyone at the same time. It's the boiling frog metaphor, except we're all the frog, the water is literally water, and someone turned off the stove and replaced it with systemic regulatory failure. And that should terrify you more than any conspiracy theory ever could. Because conspiracies require coordination. This requires nothing but time, budget cuts, and the assumption that someone else is handling it. The scariest part isn't that they lied, it's that they didn't have to. They just had to redefine what counts as safe, retrain you to accept filters as solutions, and wait for you to forget that cities used to guarantee water quality. They gaslit an entire country into thinking, here's a filter, good luck, is an acceptable substitute for, we fixed the pipes. And it worked. We all just accepted it. So here's your final question. If your tap water meets all federal standards but still contains unregulated bone-seeking elements, forever chemicals with decade-long biological half-lives, and erratic lead releases that no single test can predict, is it safe? Or is it just compliant? Yours for not becoming a chemist? Or theirs? I for building a system where that's suddenly your job? Because last time I checked, municipal water customer and self-taught toxicologist weren't supposed to be the same job description. But here we are. They didn't ask permission to make this your problem. They didn't announce the policy change. They just quietly stopped guaranteeing safety and started distributing filters. And they're betting you won't notice the difference, because noticing requires you to stop trusting. And trust is so much easier than chemistry. Trust doesn't require a reverse osmosis system or a PhD in environmental science. Trust just requires not paying attention. And we're all very good at not paying attention. So the question isn't whether your water is safe. The question is, who's responsible when it isn't? And based on the filters in your kitchen and the phones seized in Flint, I think we both know the answer. Spoiler, it's you. Congratulations on your promotion to Chief Water Safety Officer of your own household. The compensation package is non-existent, but the responsibility is endless. Living the dream. Thanks for watching.